So, like we say every episode, and I promise we'll keep saying it, this whole podcast is grounded in one core vision: achieving health for all at the lowest cost. It sounds simple, but that's the relentless goal, even though it often feels like the healthcare system has, completely lost the plot.
Completely lost the plot? That's putting it nicely. Should we maybe start calling it the healthcare dance? Where nobody's quite sure what steps we're supposed to follow?
Exactly. Except the dance costs over $4 trillion a year, and like half the dancers don't even have shoes. But the approach we talk about, that systems perspective, offers a way out of the chaos. It's about understanding that healthcare systems are complex, adaptive networks where every decision has ripple effects.
Right? And by systems perspective, you're not just talking about hospitals and insurance companies. You mean the whole ecosystem, all the moving parts that impact health outcomes, right?
Exactly. From policy to primary care to, I don't know, whether there's a safe sidewalk for someone to walk on, businesses, personal decisions. But honestly, a lot of what we've shared recently has been kind of conceptual. Systems, complexity, it can start to feel a little, abstract.
Yeah, like we've been teaching philosophy instead of talking about healthcare. Healthcare Philosophy 101, anyone?
Exactly. But for everyone who's still with us, thank you, by the way. We're shifting gears now. From here on out, we're going to focus more on specific, actionable implications of the system's perspective. And today, we're kicking that off by diving into 8 on-the-ground applications for transforming health systems. Practical stuff you can actually use.
Right. And when Sophia says on the ground, she doesn't just mean slogging through spreadsheets and hospital board meetings. These are ideas that, we hope, resonate in real-world scenarios. But, and this is important, you may not agree with all of them.
And honestly, that's by design. None of this is about us handing you some perfect recipe for success. It's really about starting a conversation, a joint learning journey. The 8 points we'll cover today, they're not the only answers for sure, but they'll give you a sense of how this systems approach can actually change health systems for the better.
And we'll tackle all of these in more depth in future episodes. I mean, let's be real. You don't get systemic transformation in 45 minutes, right?
Exactly. So, stick with us. And to start, let's jump into this list of 8 practical ideas and see where they take us.
All right. So kicking off with universal health insurance as our first idea, here's something I've been thinking about. Haven't we already seen some steps in that direction? With Medicare, Medicaid, and even that EMTALA thing you told me about before?
Exactly, David. The Emergency Medical Treatment and Labor Act, EMTALA, basically forces hospitals to treat you, whether or not you can pay. And when you zoom out, it's like we've been trying to patch together a universal insurance system for decades, just in the most convoluted, inefficient way possible.
So it's like we're halfway in? We want the benefits of universal health care, but we're, scared to do it efficiently?
Well, yeah, pretty much. I mean, think about it. Medicare covers seniors and some disabled individuals. Medicaid is for low-income families. Then there's private insurance, employer plans. It's all just layers, and more layers that leave millions of people uninsured or underinsured. And that patchwork comes with so much wasted time, money, and energy.
And let me guess, it still doesn't serve everyone effectively, right?
Exactly. It's like trying to build a house with a bunch of mismatched tools and materials. You might get a roof over your head, but it's not exactly stable or equitable. If the goal is truly to ensure everyone has access to healthcare, the logical step is to just provide it universally from the start and make it simple.
Wait, what? Like simplify healthcare? That sounds illegal.
I know, right? But it's not rocket science. Other countries already do it. You create a single system that covers basic care for everyone. Think of it as automatic, basic, and free to access. Healthcare would just be a given, like public education or fire departments.
But let me ask you this. Why don't we do it here? Like, what's the big roadblock? Is it politics, economics, or just good old-fashioned bureaucracy?
It's all of the above, honestly. There's this fear that universal equals socialism, or a loss of individual choice, which isn't true. Plus, the sheer complexity of switching to a new system and the power of entrenched interests like insurance companies makes change, politically daunting. But the bottom line is, we're already paying for this patchwork mess through taxes, insurance premiums, and out-of-pocket expenses. It's not like universal coverage would add new costs from thin air.
Right, so we're kind of already funding something universal, except it's not working properly and costs way more than it should.
Exactly. The inefficiency is staggering, and what's infuriating is we're leaving people out, millions of them, while overspending on administrative chaos. Universal health coverage isn't just about fairness, it's about common sense and fiscal responsibility. It's saying, hey, we already believe in this idea, so why not implement it in a way that actually works?
Wow. So we're overpaying for an incomplete solution. I suddenly feel like I'm back at the DMV.
Ha, exactly. But imagine a DMV where everyone had an appointment and the system actually worked. That's kind of the vision here, making the system logical, efficient, and equitable. That's the potential in universal health coverage.
And I'm guessing you have more to say about how health systems could work better? Where are we going next? Hospitals? Research?
Oh, we're diving into the idea of paying healthcare workers differently, like a system that actually rewards good outcomes, not just more surgeries or unnecessary tests.
All right, so when you talk about changing the way healthcare workers are paid, you're saying it's about rewarding good outcomes, not just performing more surgeries or running more tests. How would that work? Are we looking at something like flat salaries?
Not exactly. The idea isn't to just pay everyone one fixed amount and call it a day. It's more about creating a system that rewards the outcomes we actually want, instead of incentivizing more stuff, like more surgeries or more hospital visits for the sake of it.
Interesting. So instead of the more you do, the more you get paid, it's like do better, get paid better?
Exactly, and we'd still have salaries as the baseline, but then layer in bonuses or penalties based on meaningful metrics. Think life expectancy, quality adjusted life years, or even community health outcomes. Stuff that actually matters, not just churned out academic publications or procedural volume.
Okay, but here's where my brain kind of breaks. You're saying a surgeon, like one who's world class at these incredibly precise, life-saving operations, might get paid less if the community's health suffers. That feels counterintuitive.
I know, and it's a tough mental shift. But yes, even a great neurosurgeon would be incentivized not just to perform perfect surgeries, but to actively prevent them when possible, by encouraging healthier lifestyles, physical therapy, or addressing things like diet and exercise with patients. The idea is that being a great technical expert isn't enough. We need health professionals to lead meaningful prevention efforts too.
But isn't that unfair? I mean, what can a surgeon do about whether someone eats broccoli or lives near a decent park?
You're right that health professionals can't control everything, but they play a big role in shaping those mindsets and behaviors. And it's not just about what the individual surgeon can do, it's also about fostering collaboration between healthcare and, say, public health or urban planning. It's a systems issue, not just an individual one.
So doctors, nurses, and specialists would essentially have to think beyond their little piece of the puzzle, like they're responsible for the whole picture?
Exactly. And even if you don't fully agree with this approach, lots of people won't. It opens up a valuable conversation about how differently our health system could be structured. Imagine how much more effective the system could be if every role was aligned toward shared goals, instead of just isolated tasks or individual metrics.
Yeah, I guess it forces us to think about how specialists and public health workers could collaborate better, and maybe even how non-healthcare organizations like schools or churches could get involved.
Exactly. That's where it gets exciting, thinking about how the healthcare system could energize the nonprofit sector or work with community leaders. It's not just about fixing hospitals, it's about activating an entire network to support health. That's the real challenge and opportunity here.
Wow. Okay, I think I'm starting to see the vision, but it's definitely provocative.
It is, and it has to be, because if we're serious about fixing healthcare, incremental tweaks won't cut it. We need new frameworks, new ways of thinking.
So, Sophia, speaking of collaboration and new frameworks, how do nurse practitioners fit into all of this? Are we about to dive into those scope of practice debates?
Sort of, but it's actually bigger than that. Here's the thing. Imagine a nurse practitioner who's been working in primary care for, say, 20 years. She's handling patients independently, her physician colleagues respect her, and she's even got procedural skills that some physicians don't. Now, if she wanted to become a physician, she'd have to start over, like at least 7 years of additional training. Does that make sense to you?
Wait, 7 years? For someone who's already been doing the job? That feels like telling a senior pilot to go back to flight school because why?
Exactly. It makes no sense. The way we handle licensing, education, specialty board certifications, it's all stuck in another era. I mean, these pathways were designed decades ago, back when the world of medicine looked completely different.
So you're saying we're operating on an outdated rule book?
Exactly. And it's not just about nurse practitioners. Think about physician assistants, too. There are thousands of incredibly experienced professionals out there, some with more clinical skills than brand new physicians. But the system doesn't recognize experience or competency the way it should.
Okay. But on the flip side, aren't there also practitioners, like newer ones, who maybe lack the experience or the training, but are still taking on a lot of responsibility?
Absolutely, and that's the tricky part. It's not about saying everyone in those roles is ready for more responsibility. It's about creating pathways that reward skill and competency, not just time served or letters after your name.
So instead of one size fits all, you'd make the system more, what, flexible?
Exactly, and competency-based licensing is one way to do that. It focuses on what people can actually do, what they've proven themselves capable of, rather than rigid, outdated criteria. The idea is to meet people where they are and adapt the system to reflect real-world expertise.
But how do you ensure quality? Like, how would you balance flexibility with, I don't know, maintaining high standards?
That's the million-dollar question. You'd have to start by setting very clear, rigorous benchmarks for competency. And you'd need systems in place for ongoing evaluation, not just a one-time test, but continuous assessments that reflect real practice. There would be other markers as well, clinical assessments, letters of recommendation. The entire education training approach would have to be flipped.
It does sound like a smarter way to do things. But wow, wouldn't this shake up the whole healthcare hierarchy?
Oh, absolutely. You're talking about upending deeply entrenched systems, not to mention a lot of egos. But if we want a healthcare workforce that's both effective and equitable, we can't keep relying on decades-old models that honestly don't serve anyone well anymore.
I have to admit, it feels both sensible and controversial, like a mix of common sense and a fight waiting to happen.
You're not wrong. But the alternative is just standing still while the gaps in care, burnout rates, and inefficiencies keep piling up. And I think we've all had enough of that, don't you?
So, Sophia, if we're really going to overhaul the system like you're suggesting, making everything competency-based, does that mean future medical students would need to rethink their entire pre-med path? I mean, wouldn't that spark some kind of massive pushback?
It would definitely ruffle some feathers, yeah. But think about the bigger picture here. If we really want future healthcare leaders to fix the system, not just work within it, we need to train them to think differently from the very beginning. And that's what a health systems transformation major would do.
All right, hold on. You're talking about training doctors to fix the system, or training them to navigate it better? Like, which is it?
Neither, actually. It's not about navigating it more effectively, and it's certainly not about maximizing profits off of it. The goal is transformation, looking at the system as a whole and asking, how can we reimagine this thing so it actually prioritizes health outcomes and equity?
Okay, but that's a huge ask, isn't it? I mean, most pre-med students are already drowning in, what? Organic chemistry, physics, biolab, and now we're adding this?
Exactly. They'd still take all the traditional pre-med requirements, no free passes there, but layering in coursework on systems thinking, public health, social change, organizational culture, and policy would give them the tools to, see beyond the exam room. How can we expect them to fix a broken system if they've never learned how it works or why it's broken?
Fair point. But won't this feel kind of like asking a pre-med student to major in rocket science before they even learn to fly the plane?
A little maybe. But look, healthcare is already so interconnected between technology, policy, economics, that we can't keep pretending doctors can just focus on individual patients. They need a foundation in system-level thinking. Otherwise, we're just training another generation to repeat the same, mistakes.
All right, but wouldn't this scare some people off? Like students who might have gone into medicine but don't, because this feels like too much?
It might. But what we'd gain in return is huge. We'd create a critical mass of what I like to call system stewards. People who not only deliver care, but also lead the charge in transforming how care is delivered. And in a broken system, that's what we desperately need.
So this isn't just about adding knowledge. It's about changing the way future doctors, nurses, and everyone else in healthcare thinks.
Exactly. It's about perspective. Healthcare professionals often get so caught up in their specific roles, whether they're surgeons or hospital administrators, that they lose sight of how their work impacts the system as a whole. A major like this would force them to think at both levels, the micro and the macro.
Okay, but sell me on this. What exactly would a class in this major even look like? Like, what's the day-to-day vibe?
Great question. Imagine a class where instead of dissecting frogs in a lab, students dissect, say, the U.S. healthcare budget, or trace the ripple effects of a single policy change across an entire hospital network. They'd analyze case studies, work on interdisciplinary projects, and honestly, just learn to see the system from multiple angles. Then they would consider how successful social change movements have happened in the past and apply lessons learned to today.
And would you make this mandatory for, like, just doctors? Or are we pulling everyone into this? Pharmacists, physical therapists, dental hygienists?
Everyone. At the very least, they'd need a minor in it, because no matter what role you play in healthcare, you're part of a larger system. If every professional had at least a baseline understanding of how that system works and how to improve it, imagine the collective impact we could make.
Okay, but let's be real. Wouldn't this whole idea face, like, massive pushback from schools, from students, from basically everybody?
For sure, change is never easy, and this would be a big one. But if we keep waiting for the perfect moment to overhaul healthcare education, it's never going to come. Sometimes you've got to lead with bold ideas and let the details catch up later. And speaking of system stewards, one thing we sometimes miss is that the formal healthcare system alone isn't enough to improve health outcomes. If we're truly serious about making an impact, we've got to also include community organizations, churches, and local nonprofits in the equation. These groups play a crucial role in bridging the gap between the healthcare system and people's everyday lives.
Okay, but wait. How do organizations like, I don't know, a local church or a PTA even become part of this conversation? They're not exactly handing out stethoscopes at Sunday service.
You're right, they're not. But think about what they do offer: trust, deep local knowledge, and existing relationships. These groups already know who's struggling with chronic conditions, who's battling food insecurity, or who needs better access to mental health care. They're already embedded in communities in a way that large impersonal systems can only dream of.
So you're saying they're kind of like connectors? The glue holding everything together?
Exactly. They can connect people to services they need, whether that's health screenings, affordable medication, or social support systems. And more than that, they can mobilize around big-picture health initiatives, whether it's starting a community walking group or organizing workshops on managing diabetes. Things that might sound small but actually have huge impacts over time.
That's huge. But then, here's my obvious question. How do you even bring these groups to the table? Like, the healthcare system feels so bureaucratic. How do you ensure that, they actually want to work together?
Great point. You can't just parachute in and expect groups to jump on board. It has to be a two-way street. The healthcare system has to listen, understand these organizations' strengths, and honestly get out of their own way sometimes. It's about respect and collaboration. Like, instead of imposing initiatives from the top down, we need to ask, what do you see happening in your community? What do you need to help improve it? And that's more likely if, like we considered above, health professionals are incentivized to improve health, not just see patients or teach classes.
So instead of healthcare systems saying, here's what we need from you, it's more like, here's how we can help you help others?
Exactly. It's about empowering these groups to do what they already do best. And when we invest in them, whether that's funding, data, or just backing their ideas, their reach and impact can go so much further.
Okay, but back to the funding part, because I can't stop thinking about money. Where does the healthcare system even find the budget for this? Aren't they already stretched pretty thin?
They are, but here's the thing. Not investing in communities actually costs more in the long run. Let's take something simple like addressing food deserts. If a local nonprofit can help improve access to healthy food, you'll have fewer people winding up in the ER with preventable diet-related illnesses. There's a financial logic to this. Investing in prevention saves billions on treatment.
Right, but we're talking about system thinking again, aren't we? Seeing healthcare not just as hospitals and clinics, but as, what, a partnership between these bigger networks?
Exactly. And it's also about dismantling the idea that health only happens inside a doctor's office. A lot of it happens in homes, schools, workplaces, places these organizations already have access to. If we don't harness their potential, we're missing a massive opportunity.
Okay, so we're talking partnerships, prevention, and trust. But doesn't that also mean we need to rethink how we measure success? Like, health impacts from these groups probably won't show up on a hospital spreadsheet, right?
Exactly. We need to measure success differently. Things like community health outcomes, engagement rates, or even the number of people accessing preventive services. If we're too focused on traditional metrics, we're going to overlook the real value they bring,
So linking these groups to the formal system isn't just about fixing what's broken. It's about, redefining what good health even means.
right? And it's about embracing the idea that health isn't solely the responsibility of doctors or nurses, it's something we can all contribute to together. When we think about the kinds of leaders who can really make these partnerships work, they're often not the traditional ones. They might be younger, unconventional, or even a bit rebellious. But those traits are exactly what helps them build trust, foster collaboration, and drive the kind of innovative thinking we've been talking about.
Wait, rebellious? Are we talking about doctors wearing leather jackets and starting healthcare revolutions in back alleys?
Ha! Not quite, but close. What I mean is they're willing to challenge the status quo, see possibilities where others see roadblocks. And let's be real, in a system as resistant to change as healthcare, you kind of have to be a little rebellious to make things happen.
So they're the rule breakers, the ones who see the cracks in the foundation and start swinging their metaphorical hammers?
Exactly. But it's not just about disruption for disruption's sake. The best transformational leaders are the ones who pair bold ideas with practical steps. They can navigate existing systems while also pushing for entirely new paradigms. That's a rare combination.
All right, but how do we spot them? I mean, these don't sound like the folks making the keynote speeches at fancy healthcare conferences.
Right, and that's part of the problem. These leaders often aren't in the spotlight. They're busy innovating behind the scenes. But if you want to find them, look at the unconventional success stories. Communities thriving against the odds. Policies getting traction in places no one thought possible. Those are the breadcrumbs.
Okay, so once we find these rebels with a cause, what happens next? Like, do we just, I don't know, hand them a megaphone?
Not quite, but close. We need to elevate them, amplify their work, connect them to resources, and honestly, give them the freedom to experiment. The best thing we can do is clear paths for them to lead without getting bogged down by bureaucracy.
And I'm guessing that involves getting the old guard to step aside? That sounds like a pretty tall order.
It is. Transformational leaders often face resistance, sometimes from those they're trying to help. But the more we celebrate their successes, the harder it becomes to ignore them. Highlighting their impact creates a ripple effect, encouraging others to step into similar roles.
So it's not just about finding leaders. It's about building a culture that, supports and sustains them.
Exactly. Recognizing them isn't enough. We have to actively nurture their potential. And when we do that, we pave the way for the next generation of innovators to step forward.
So if the goal is to elevate these transformational leaders, is that where these hubs of system stewards come in? It sounds cool, but also kind of vague. What exactly are we talking about here?
Great question. So, think of these hubs as like nerve centers within health organizations, places designed to bring people together who can think about the whole system, not just their piece of it. Hospitals could have them, advocacy groups, even university health departments. The whole point is to make sure there's always a group thinking beyond the day-to-day operations.
Okay, but what are these hubs actually doing? Are they just think tanks, like sitting around in a room brainstorming solutions?
Not exactly. They're more action-oriented. It's about embedding systems-level thinking into the organization. So instead of looking at problems in isolation, say, improving patient discharge times, they're asking, how does this connect to staffing, to community health needs, to long-term outcomes? And then creating actionable strategies that align all those threads.
All right, but that sounds like a lot. Who's actually in these hubs? Are we talking hospital administrators, doctors, community health workers, or is it just whoever shows up?
It's definitely not a whoever shows up situation. You need a diverse mix of people: clinical staff, public health experts, maybe even data scientists. And the key is that these people are trained in systems thinking, not just experts in their own fields, but skilled at seeing the bigger picture and finding connections others might miss.
Okay, but here's the thing, and maybe it's the skeptic in me. How do you convince busy healthcare professionals to take on this kind of work? I mean, let's be real. They've already got their hands full.
You're absolutely right. The only way it works is if organizations create the space and incentive for it. That could mean funding these hubs, giving team members protected time to dedicate to it, or even tying their success to broader organizational goals. It can't just be another add-on, or it'll fail.
Okay, but what about smaller organizations, like rural clinics or small nonprofits? How do they set up something like this if they don't have big budgets or extra staff?
Good point. Smaller organizations would need to collaborate, maybe set up regional hubs, or align with larger institutions who can share resources. It's not one size fits all, but the concept is scalable. Even if you're a small clinic, having someone in charge of connecting the dots across systems can make a huge difference.
It kind of sounds like you're building lighthouses in the fog, places that can, guide everyone else toward the bigger picture.
Exactly. And the more of these lighthouses we have, the more interconnected the system becomes. It turns healthcare into less of a patchwork and more of a coherent shared effort toward better outcomes.
All right, but let's be real. If systems transformation is this important, who's footing the bill for these hubs? Where does the money actually come from?
That's the real trick, isn't it? And it ties right into our next point because, believe it or not, if the vision is bold enough, funders tend to show up.
You talked about bold visions attracting funders, but $400 billion? That's not exactly pocket change. Where's that kind of money even supposed to come from?
Fair question. And the answer is, well, not all of it has to come from one place. It could be a mix of government funding, private sector investment, even global partnerships. The key is to create a vision bold enough that funders can't help but want to be part of it.
So it's like if you build it, they'll come? Except it is a $400 billion health fund?
Kind of. But it's more than just building something flashy. Funders, whether public or private, want to see ideas that work, that solve real problems, and that have measurable outcomes. This wouldn't just be a pile of money sitting in a corner. It's about fostering competition and innovation in health systems on a transformative scale.
Okay, but how do you even set that up? Like, are we talking grants, contracts, contests? What's the mechanism here?
It could be all of the above, honestly, but I think competitive proposals would be the backbone. Imagine healthcare organizations, universities, even startups pitching ideas that could completely reshape how we operate as a health system. And the best ones, backed by solid data and potential for impact, get funding.
So it's not just about throwing money at problems. It's making people prove their ideas have teeth?
Exactly. It's about accountability and scalability. A proposal would have to be innovative, but also practical enough to be piloted, tested, and expanded. And that's where the competitive element comes in, sparking this healthy pressure to think bigger and bolder.
Right. But here's where I'm stuck. What would these proposals even look like? Like, are we talking about tech solutions, new hospital models, or something totally out of left field?
All of the above. You might see proposals for community-driven care models, AI-powered diagnostics, or policy frameworks that tackle equity gaps. The point is to open the door to all kinds of transformative ideas, some that might feel risky at first, but that have the potential to revolutionize health systems.
Okay, but you mentioned risk. How do we make sure this money doesn't just, disappear into projects that fail or never scale up?
That's where oversight is vital. You need a robust evaluation framework, something that constantly measures outcomes, progress, and scalability. It also helps to diversify investments across multiple proposals, so you're not betting everything on one horse.
Right, that makes sense. So instead of aiming for one perfect solution, it's like planting a bunch of seeds and seeing which ones grow?
Exactly. The idea is to create an ecosystem of innovation, rather than just banking on one silver bullet. And here's the thing. The $400 billion isn't just an expense, it's an investment. If even a fraction of these proposals succeed, the potential return on quality of care, outcomes, and costs would be astronomical.
All right, ambitious. But I'm guessing we're not just talking about scoring big wins. It's also about reshaping how we even think about healthcare innovation, right?
Absolutely. A fund this size sends a powerful signal. that we're serious about transformation, not just tinkering around the edges. And by bringing in this level of capital expertise and competition, we start to push the boundaries of what's possible. Exactly. And that's the big picture here. If we really embrace this ambition and commit to pushing boundaries, we're not just improving healthcare, we're redefining it. Imagine a system that leads the world in innovation, equity, and outcomes. A system that doesn't just respond to challenges, but sets a new standard for what's possible. That's the opportunity we're talking about.
You know what really sticks with me, Sophia? It's not just the scale of the idea. It's the why behind it. This isn't some abstract policy discussion. This is about our families, our friends, our coworkers.
And our economy, too.
Exactly. This is about making sure the people we love, heck, even the people we don't know, actually have a shot at living healthier, better lives. It's big stuff, and yeah, it can feel overwhelming, but I also think it's kinda inspiring.
Absolutely. And that's why we keep coming back to this systems perspective. It's not about giving up because the problems seem too enormous. It's about using the tools, the ideas, the people around us to make real, meaningful change. Change that benefits everyone.
So, let's do it. It starts with these conversations, right? Talking, challenging ideas, and figuring out what's possible. I, for one, feel a little more hopeful today than I did before we hit record.
Same here, David. Conversations like this remind us that health systems transformation isn't just a pipe dream. It's something we can do if we're willing to rethink, rebuild, and reinvest in the system and in each other.
And that's a wrap. Thanks, everyone, for joining us for another deep dive into health systems that, let's be real, need a lot of love and attention. Sophia, always a pleasure.
Always. And to our listeners, thank you for sticking with us. We'll see you next time on It's Time.